talked a little bit about, mentioned conflict before. It's an area that I've been doing some research as well. And I think while it's important not to simplify, because each conflict setting is a separate conflict setting, the roots and the causes, of course, are different in each setting. But in terms of masculinities, there are a few things that we see come out there. One, there's often this deliberate manipulation of unemployed and disgruntled boys and men by many armed groups. We often see that armed groups become a place where young men and boys look up to the guys who hold power and are higher up in the command structures, kind of surrogate families and surrogate male role models. For many young men who've been frustrated that they can't be recognized publicly as adult men because they haven't achieved these prerequisites, holding a gun and the power that comes with that, in terms of access to money and other resources, access to sex and the sexual violence that we too often see, and simply status of what you can wield now that we have lightweight weapons that 13-year-old boys can hold. You see any of who have spent any time in conflict areas to watch just how young men can immediately step into the sense of power and abuse of power by having a weapon in their hands. And the tremendous challenge that we have in many parts of the world is we're working toward ending conflicts to say, how do young men in that setting, how do we convince them to revert to a civilian status that does require them to lose some kind of status, to some of the power that they've had carrying weapons, to go back to civilian life with very few guarantees of income, stable income, access to education, and other things that would allow them to have sustainable livelihoods. The anger and the frustration that we see about young men in particular in IDP camps, women as well, but the frustration often acted out in violent ways on the part of men and young men in IDP and other refugee camps. And the whole issue of unlearning violence that we too often see spills over from the battlefield into the intimate partner relationship, and the challenge of helping men in settings like that step out of the use of violence as a way to express their identity and use of power. In all this talking about men, I think it is important to acknowledge, I'm not trying to paint a picture of saying in the gender field we got it all wrong and actually men are the new victims. I think it's important that we avoid that kind of pendulum that too often we kind of seem to get stuck in, and to acknowledge that we can see men's vulnerabilities, we can see how they're connected to women's vulnerabilities, but we can't lose sight of these huge inequalities. That globally we know from World Bank data, if you kind of weight the world's income of men's compared to women, that women's income is on average 22% less than men's. So no matter where we're talking about men's economic stress, we've got to understand that women's access to income is still less on aggregate than men. We have to acknowledge the care burden, that even as women's income has increased, their care burden typically has not. So they're typically taking on both sets of that data. As we look at time use studies around the world, women are spending on average, depending on country, setting, et cetera, 2 to 10 times the amount of work in care for others at the household level than men do. We know, of course, the global UN data showing that about a third of women globally will experience physical violence from a male partner during their lifetime. If we look at the issue of reproductive health, still, in spite of our years of focusing on male involvement, trying to get men in the door, reproductive health clinics, condom promotion, that we do have some success stories, still globally women are responsible for about 3/4 of contraceptive use. So no matter, while we're talking about men and acknowledging and understanding their vulnerabilities, I think it's important that we not lose sight of this global gender inequality equation that we've got to put men within. Where are we? I saw that one of the publications on the table was about MDGs and GBV and thinking about kind of how they overlap. I think as we look at where we are on some of the MDGs and whether we've achieved some success for empowering women and achieving something closer to parity on some issues related to women, what does this mean and how do we think about moving forward and engaging men around them? One of the success stories of international development, I think, is around education, at least at the primary level. 95% of countries have achieved, after this push of the last 25 years, in terms of achieving educational parity for girls, we have achieved something, at least in many countries. What we're finding more and more, however, is that secondary education seems to be the key one, as we want to look at reducing the vulnerability to sexual exploitation, to participation in transactional sex, or to other forms of sexual violence, that in fact it's secondary education that we probably need to think about working more on, that primary education is important, but it's not enough in terms of empowerment that secondary education seems to bring. We've approached and continue to expand women's economic empowerment. I think you had a presentation by Julia Kim recently, if I'm not mistaken. We've got increasing evidence about what, and I won't cite the image data there because you heard a presentation from Julia. We've got increasing evidence of how well-designed microcredit, microenterprise, and income-based or women's economic empowerment approaches can work to empower women economically and in turn in some settings to reduce gender-based violence. There are globally at the moment some 100 million plus beneficiaries of microcredit, microfinance programs, and there's been a big focus on women within those. About 70% of those beneficiaries are women. And we do have some evidence that those can work in given settings to reduce women's economic vulnerability, household economic vulnerability, and also to reduce gender-based violence. What do we think about men in the midst of all this? One of the things that we hear and see as we interview women involved in such programs around the world is that we're encouraging women to do more work outside the home, but we haven't done much to share or to shift the care burden. While women are continuing to work in increasing numbers, even in parts of the world where that's not been the norm, men are not stepping up and doing more of their work in terms of the care burden. In some settings, if we don't have the whole comprehensive package of the kind that Image in South Africa did, we actually see in some settings that women's economic empowerment can lead to an increase in violence against women. As men have trouble dealing with women's enhanced economic power, they have challenges about that, the household dynamic has been disrupted, some men themselves feeling economically stressed can sometimes resort to using more violence, at least in the short term, telling us that perhaps we've got to think more about how do we engage men when we engage women in targeted women's economic empowerment. How might we also think about engaging men? And I like this quote from Ahmed, who was doing some research with men within the Grameen Bank in Pakistan, who said, we too often look at such programs in a very simplistic way. Economically empower women and men will fall in line, or that either all men are opposed or all men will necessarily immediately fall into line. And she calls our attention to the need to really understand the plurality of men in terms of how men react to women's new economic empowerment, whether it's through a microcredit program or simply happening because that's the nature of the changing workforce in the world. And she says, the concept of the universal man that is implemented in these programs falsely assumes that men are all alike and inimical to women's rights. On the other hand, the framework also assumes that once the woman starts earning, her husband as the universal man will inevitably start to value her and things will improve in the household. But this imposition of sameness is a belief as yet unsupported by the evidence. And that's a challenge for those of us at the program level because men don't always act in some preconceived notion. And the need for us to be quite attentive as we design such programming, to listen to what's going on in men's lives as we've been listening when we do good programming to what's going on in women's lives. So I want to share with you some of the data from this big data set that we've just gathered. 6 countries, Brazil, Mexico, Chile, Rwanda, Croatia, and India. This is household survey data, men and women ages 18 to 59, urban settings in all but Rwanda, 1 to 3 cities, mostly following the WHO multi-country study on violence against women sampling framework of 1 major urban area and 1 secondary urban area, covering all the income strata as well as all the education strata. Rwanda is the only exception where it's a nationally representative household sample, including urban and rural areas. Altogether, we interviewed 11,000 women and men, about a 25-page questionnaire. For men, a slightly shorter one for women because we have much of this data in DHS because we've been asking women a lot more of these questions. The basic questions were around men's attitudes and practices, household decision-making, who does what at the household level, men's own health issues as well as their participation in women's health issues, MCH, how much they were involved in the care of children, work-related stress, attitudes around gender norms, men's knowledge about existing policies, and hence you see how it got to be a 25-page questionnaire. It was a bit long. We wouldn't advise other folks to do quite all 25 pages. We had challenges in a few countries of men getting a bit frustrated after sitting there for 25 minutes and answering all the questions. But we did find it quite useful that by the time you kind of got men down to 20 minutes, they were so worn out that they would answer just about everything that we asked of them. So we feel that we've got quite good data. We compare women's responses to men's responses, never interviewed men and women in the same household. Because they're both reporting on issues of violence, et cetera. So for ethical concerns, never interviewing at the same household level, but of course in the same communities. So we've got a bit of a he said and a she said. And we're not necessarily taking his version or her version as being the truth, but kind of understanding how men and women talk about these issues. So this is the first time we're about to launch this data officially, as I mentioned, next week. So I'm pleased to present some of the first slides that we're looking at around the data. So the first one is men's reports of intimate partner violence of men compared to women. For a long time, we thought that men wouldn't tell us, that they would deny it or that they would report far less. Actually, what we're finding is rates range from the blue, if you can, probably looks purple to you, and kind of brown. Those are men's reports in the blue and women's reports in the beige there. You can see the differences are quite slight, with the exception of Mexico. Mexico had a slightly different sampling framework in that women also interviewed men. Women interviewed women, and we didn't find enough men interviewers, and so actually some women interviewed men. We think that probably led to some underreporting of men's reports of their use of violence. But you see the ranges are quite close to what the WHO multi-country study found. So roughly 24% of men to a high of 41% in the case of, or 39% in the case of Rwanda, reported that they had ever used physical violence against an intimate partner over their lifetime. These are quite similar rates, as I said before, to women's reports and what other studies have found. So we think that at least on that indicator, which tells us that the factors that we're going to look at that are associated with that we're going from a database that seems to resonate with what other household surveys have told us, and that men's and women's reports were not all that far off. Men were underreporting a bit if we take women's reports as the true reports of their experiences, but they weren't that far off. As we looked at the factors then, so what seems to be associated with those men who report higher rates of violence against women? In most countries, education was a factor. Men who had secondary and university education levels tended to have slightly lower reports of violence against women. Gender norms, we used a scale called the Gender Equitable Men Scale. It's a series of attitude questions to measure how much men buy into a rigid view of what it means to be men, an inequitable view or a more equitable view. Those norms were quite associated. Work stress was also a key one. I don't know if you can, the light's making it hard to see, but the red bar shows the reports of those men who reported economic stress, as I described before, and their reports of violence. And you'll see across the board, except Mexico, with the anomaly that I mentioned about the sampling methodology there, all the other countries show that men who reported economic stress show statistically significant higher rates of use of violence against women. And that is across the income sectors. So in fact, income per se was less a factor than whether men reported not having as much income or work as they thought they should to be able to fulfill this role of provider. So again, and I think that's not a surprise to many of you, as we know in moments of economic stress, we tend to see calls to hotlines, domestic shelters filling up. Certainly we have data in the US about that. I'm guessing there's probably similar trends going on in this particular economic moment in Ireland as well.